And we are live. Hello, everyone. Welcome to LabOPEX Live. And today we have another interesting topic and a very interesting guest, Letycia Núñez. And Letycia is bringing a new angle to some of the resources that are needed in medical lab professional and some of the challenges we are having and possible solutions. So welcome, Letycia.
Hello, it's great to be here today.
So if you're coming on as usual, just tell us who you are. I see we have some guests already. I'm not sure if they're on Facebook or LinkedIn, but just put your name in the chat so we know you're here. We want to make sure that we're interacting. We can answer some of your questions. We can get feedback from you. So just put your name in the chat and tell us where you're coming in from. So we're going to just jump in while we wait on. I know we have a few people on, but just go ahead and let us know. So we're starting out with Letycia just telling us a little bit about her background, what she's involved in, how she's related in a way to the medical lab professional.
Sure, thanks. And I wanted to have a little intro. Currently, I am a clinical assistant professor at the University of Kansas Medical Center in Kansas City. I am responsible for teaching immunology content for both the graduate and the undergraduate programs that we have here. I have been teaching laboratory science students for since 2014, formally full-time, but I am an MLS trained professional. I trained in the University of North Carolina, Chapel Hill, 2007 grad. So it's been a minute. And I've worked in laboratories both in the US and in Mexico. And I have a background in public health. I did a master's in public health as well. And I'm currently completing a PhD in health policy and management. So that's a little bit of the background that I have as far as connected to laboratory. I'm very passionate about training of new professionals and getting some policies advanced. I'm very active in our professional societies to try to get more funding and more resources for our profession.
Awesome. So I can see where you're probably good with research, seeing how understanding where we are in terms of our status when it comes to different things. Now we're talking about qualified medical lab professionals. So as a policy person, I'm sure you have done a lot of surveys and talked to different people. So that's really important for us to have real and true information, true data that leads to information. So tell us a little bit about what are some of the things you're actually working on now, some of the projects you're working on.
Sure. And so part of the interest that I have in health policy, and one of the reasons, and the program I'm in is policy and management. And I did management as a public health concentration, because one of the things I saw in laboratory is that we have a lot of very good management resources. We've developed a lot of really good processes, but it's kind of this hidden gem that is in the laboratory where we've solved problems and can make things work better, but nobody really sees a lot of that, what's going on in the inside of the laboratory. Now, there's a lot of work in trying to publish that management literature and applying models to this work in management. And so that was part of one of the questions I had, because as you know, one of the biggest challenges we have at this point is staffing. And I know other people have talked about that. So my question right now is, how does staffing levels and turnover impact the health of laboratory professionals, and how working in different environments based on rurality, so rural areas versus laboratories in larger urban areas, can affect the ways that laboratorians are working, and maybe causing them health issues that may cause them to leave. And even exacerbate that staffing situation even more. So we did see some of that during a little study that we ran last year during COVID, which COVID is still very much ongoing, but COVID has put such a huge strain on our fellow laboratory professionals and everyone who's currently actively working in the laboratory. And to me, reading that feedback, job satisfaction going down, people, but then also the flip side, which is people feeling like they had more visibility for the profession because we were very much at the forefront, testing, right? And so there's this really interesting dynamic that's going on, but that doesn't seem to make things better for our profession overall. Pay didn't go up for a lot of people. A lot of people have left because of this pandemic. And so it's something that needs to be studied and understood more. We want to know what is going on. And some data has come out, but it's so slow that we still need to collect it and make sure that we're learning and understanding what's happening with our profession. So right now, that's the focus I have. I am very lucky to be partnering with AACP on this work. They're going to be helping with some of this information gathering. But I'm also very fortunate to have the opportunity to talk to rural people working in rural areas, because as you know, Kansas is a very large rural state. And so we're going to be investigating what's going on with our fellow laboratory workers out in more isolated environments to see what makes them still go to work every day, and so that we can, help with that and make it even better.
We are so lucky to have people like you, Letycia, that will take on these studies, because a lot of times, you have people just either we're complaining or we're using our isolated situation to judge the big picture. So I may be in a lab that don't have some of those challenges, and I may think that that's the world for me, or somebody else may be in another lab. So when you as an educator or researcher can actually partner with some of our professional organization to collect the real data, to do the research, to do the analysis in a proper way and a scientific way, we're really lucky. And I'm going to take a little pause to say hi to, so we have Anthony. Thanks so much, Anthony, for always supporting LabOPEX Live. We have Patty, and Patty is great in this audience based on this discussion. A lot of things that you just brought up about the challenges with COVID. Patty actually was on this show talking about the health effect of staffing or even COVID. And I think Patty is in one of those rural labs, so we could get some real good feedback from Patty. And then there's Angela. Angela has a wealth of information, worked so well with the different professional society. Angela is saying educators are awesome and critical for graduating qualified new lab professionals and colleagues. And Dr. Stalos is saying, howdy from Dallas. Looking forward to diving deeper into this topic, Roach, at the last LabOPEX. And yeah, we probably need to have some more conversations. And Dr. Todd is saying hello from Atlanta. And Courtney is saying good evening, lab community. And we have all lab leaders here. So this is a great conversation to have. And so thank you for that introduction and about, what you're doing, the interest and some of the things that you're working on. But when we think about the rural labs and even the responsibilities of medical lab professionals, explain to us, how do you see the responsibility of medical lab scientists, say, for instance, or even other professionals when it comes to reporting results, or even at some point, depending on where they're working, interpreting, because of course there's some some of our IT system that does some interpretation with references, and there's some labs, I'm not sure if people are involved in coaching, but let us know, how do you see the responsibilities that we have as medical lab professionals when it comes to reporting accurate results or possibly interpreting some of those results?
Sure. And that was something that I found extremely fascinating as I was progressing. I had the opportunity to work in a rural laboratory. Well, actually, during my internship in North Carolina, I was very lucky to visit for 3 weeks and do a period at a rural laboratory in a small critical care hospital. And it was a definite different environment where the manager and responsible for overseeing all of the testing was the youngest person and the only MLS ASCP certified person in that area. And that could be the person who had the what we would consider the training or the minimal qualifications for that job, obviously based on CLIA and all that. So that was something that had given me that insight. But then coming to Kansas, one of the things that I was interested in is that experience of when a laboratory professional is producing this test results, it usually would have to go to a physician or somewhere that would be like a holding place. And then that person would transmit the results to the patient, but they would meet with them or call them on the phone. But nowadays, there's a lot of the transition to electronic medical records where each patient has the potential to just log on and see these numbers without them necessarily having gone through their own personal healthcare professional first, who probably knows a little bit more about their health status and everything else. And so there was this question I had, like, these individuals are running the test, putting those numbers out, and the patients are seeing them with no filters. So the responsibility of producing an accurate number, an accurate measurement is, I felt like going up. And so I reached out to my wonderful network of laboratory friends, and I had some conversations, structured interviews. And what I found is that individuals who work in those smaller and or rural areas have a closer connection to their patients because they see them. And so that brought this whole dimension of when you're in the laboratory and you work in a larger city or in a larger hospital, you really are just doing your work. There's this big system around you that kind of shields you from patients. And there's this attitude of, no, it is not my responsibility to talk to patients. Whereas in those areas where you do have a bigger role, with patients actually walk in and you say hi to them as they walk by the window. And they could be the person who sells you your groceries or who you see at church on Sunday. That connection really is very different, and they do feel a lot more, that connected to their patients in that way. And so that led me to question: do they ever come to you for advice on this information? Because you are the laboratory person, and they were a lot more comfortable talking to patients about those numbers that they've produced, as opposed to those individuals who work in a larger hospital, larger cities, and so on. And so, again, thinking about those two first, that the people who are most qualified in those roles were MLS level, bachelor level trained people. But most of the people working in rural areas do not necessarily have that training. There's different training that is more available because of the distance to programs. We don't have a lot of training programs to begin with. People can't move. And so that brings a lot of questions about what are the qualifications in general in rural areas for people to run this laboratory tests. And in many places, because it's CLIA waived, anyone with a high school degree can run a lot of this. So.
So
Yeah, that's to me, I'm learning that recently also. It's so easy for different people to think that where they are is the world. And I had fallen into that group where I thought that in the lab, most people who are reporting or most people who are there are MLS or the lab text would be in the pre-analytical, and now I'm finding out that you may find just one MLS who is probably a lab director and others who are not. And then, all these questions about, where do you draw the line in terms of, there's some people are saying, well, they don't report, or there may be automation that does the reporting. So that becomes challenging. So what are some of these risks that could be involved in situations like those?
Sure. And this is something that it's one of the, it's a concern, but it's also a matter of kind of thinking about the available resources.
Mm-hmm.
Because yes, based on guidelines, an individual who has not gone through a program can run assays, certain types of assays, like those CLIA wave tests, or even some moderate complexity, depending on what it is. But even though those guidelines exist, the bar is very low. And one of the biggest concerns that I have thinking about that is when there is a problem, people who don't have adequate training can run into maybe providing a result that is not accurate because of an inadequate sample, or in an interfering substance from a medication, that someone who has had the training and has gone through a program or taken that certification would be like, oh, I'm reading in the chart, this is a condition the person has, this is a medication they're taking that will interfere with this result, so I'm not going to report it. And so these numbers could get out, or even through automation, get posted by the computer, and patients can see them, and even physicians could act on these numbers without having that check by a person who has those qualifications. And this is something that can be a safety issue, definitely. But on the other hand, and this is where I like to play a little devil's advocate. Yes, but going to a program is expensive. It's not accessible to everyone. There are there are some barriers to getting those qualified, trained, certified people, and especially in areas where there are no programs or just one and it's far away. And so how can we require or bring this bar up, this regulatory bar up? If, like you say, well, in my city, I obviously see that this should be something people could do. Yes, but in the state of Kansas, we're one of two programs, and most of the western part of the state does not have a program. So are we going to tell those people move here, and how are we going to support them? Otherwise, it's a kind of catch-22, where you have the need for people to run these assays. They are necessary tests, but we don't have a way to provide those trained human resources. And so it is a concern for patient safety either way. And we need to do something about it. There needs to be a larger effort to address this very, very real concern.
Yeah. Oh, I mean, it is. And I'm glad we're having this conversation. I know maybe this conversation has probably gone further, but for me, I think that it's good to have this conversation on this platform for people who are not aware of it, or just even to have our audience chipping in. But before we jump in, let's say hi. There's Ollie Bryan is coming in from the Philippines, and I interviewed Ollie Bryan on a podcast, and he was telling me about how closely they interact with patients in the Philippines. And basically, there are times when they have to coach these patients, say for HIV or other things, because you may have the actual medical lab scientist that may be the one procuring the specimen and have to interact with the patient and give coaching. So there's a lot of responsibility that we have as medical lab scientists. And Dana is saying greetings all. Hi, Dana. And Erin is saying hi from Jacksonville. You're doing amazing things. Thank you. Calvin Ball is saying hello from California. Aaron is saying, makes sense. It's easy to lose track of a more patient-centered lab practice. I suppose in the bigger labs, we not only have to perform the test, but also help the public understand their results. We have a lot of responsibility as medical lab scientists. Hi, Yolanda. Yolanda, reach out to me. I only get to talk to her on the line. Angela is also from a rural lab, so this is a very interesting and important conversation. And Angela Robinson saying that federal clear developed standards for all labs performing tests on human specimens, but did not equate personnel standards to regulatory standards. Personnel standards not comparable to the high regulatory standard based. I suppose it's not as people don't put a lot of emphasis enough on the personal. Nancy, oh my gosh, I am so. I mean, I don't know what to say. Nancy is on when she's on vacation. Nancy just had a baby like a few days ago. We're so honored to have you, Nancy. Nancy is clicking in her. She has a newborn baby. Congratulations, Nancy. Oh my goodness. And Yolanda is saying, message me anytime. So let's put this back off the. Yes. So this is such a. I mean, this is almost, we're scratching the surface of such an important topic. You know, this is like, we're starting this conversation that I think needs so much more conversation. And I'm glad that you're doing this work, and I'm glad that you're doing like the surveys and you're capturing, a lot of the data. But it's really challenging. And, it's like rural labs, they're left in a they're basically in a crunch when you can't find enough like qualified people. And I know that Angela was on, and she told us her method of how she designed her hiring process. That's Angela Sedona. Within a rural lab, in order to make sure her selection process, she has to be very careful with how she selects people for those roles, because I think her lab at the time, she's now a some operation manager higher than she's not just in the lab, she's looking over other departments. But at the time when she was there, I think it was just 2 MLS. And now I think it's 1 that's now the director. So they have to be really careful in their selection process and their placement. So Angela may have some input if you have questions for the audience. But what have you found during your surveys and your research on, basically the state of qualified or certified professionals in the rural lab? Or have you gathered enough information as yet?
So that is part of the challenge, and I'm glad. And this is the kind of activities that we need to be doing even more. So bringing this to larger audiences that are interested and able to share their methods, because that's really what I'm trying to do. Data on rural areas is hard to come by, even for large organizations. So, for example, recently ASCP had a job, well, I say recently, it was a couple of years ago, job satisfaction and burnout survey. And they only captured about 7% of their sample was from rural hospitals. And that's just because just reaching those audiences and having them provide us with information is hard. It has to be extremely intentional. So things like inviting someone who works there or talking to them and amplifying their voice. So I'm so glad, and it's very important to have that audience be listened to and heard. And so to me, we need more data. We need more of these voices being amplified, especially the ones that are working. So like you mentioned with Angela, it's what are the methods that you're utilizing to adequately staff your laboratories in these areas, knowing that it is a challenge and it is not the same, even in the same state. Because, and this is, again, it gets a little controversial, and I don't like to be controversial. I'm a very balance and harmony person, but there's some policy things that happen at the state level that can impact negatively those rural areas. So making decisions that require personnel to have certain level of training across the state, but then not realizing that may negatively impact some areas of the state. But then we don't collect that data. We don't know what really is happening. And so the issue is not really knowing what's going on. Now, I know that a lot of managers struggle with this. And like you said, it's not about complaining. It's about being proactive and sharing what works and what doesn't work. And putting it out there's plenty of blogs and newsletters from laboratory organizations where we can share that information. And now with social media and LinkedIn and all of these wonderful platforms, it is to put that information out there and to, share these methods, because otherwise everybody thinks that they're solving the problem in their little area, but then everybody else, across the state line is still suffering. And we need to share these techniques, this good management practices that people are already doing. And if you come from a place where you worked in a rural area and you could see what they were doing wrong, I feel like there's also an obligation to say, like, you shouldn't do this because this is not helping. This is creating more problems. And so it's like sharing the good, the bad, and the ugly, and working on a solution that helps everyone. Because to a certain level, it's going to be different, but something that works for someone can help another person. And so to me, that's one of the goals that I have with this survey. So we're going to be running the survey through the end of this year. We're still putting it together because we're getting some feedback from some of our colleagues working in rural laboratories. And we want to make sure that we have some good questions that are going to get to the heart of some of these problems. So I welcome anyone in the audience who's interested in wanting to get involved. Please contact me through LinkedIn or Facebook or any of the other ways, because I want to hear what the concerns are so we can gather this very good data and help more people. I need you to tell us what works.
Right. So Angela is saying that as you said, Lona, in our lab, the director is the only MLS. All others are MLT, and we just began using Lab Assistant to report up to moderate complexity. But we have strict rules. Lab Assistant don't report delta checks, critical results, interpret QC or results. No manual dilution. It's very strict. So it is so challenging that we are at the point where we're using Lab Assistants to do some of the work. Of course, there's clear guidelines that you have to be careful about and very strict about, but it's showing the major need that we have, that this is now, something that we need a lot of attention to look at this instead of just going along with the problem or doing with the problem. So it's really that is some major problem. And I love that you're actually reaching out to get the data and for people not to be comfortable in their situation and don't respond to these surveys, because especially if they're getting by, they may not see it as such a problem to bring this to maybe the state level or to whatever level that it needs to go to respond to these surveys. So thank you so much, Angela. And Angela is very active. She has a lab leadership group on Facebook, very engaged, a very huge group. I mean, there's just so much you can learn from that. So Thanks so much, Angela. And we're gonna give. Let's get this back here. We're gonna give at the end. We'll give your information. So, Robert, hi, Robert. Thanks for passing by. And Patty's also in a rural lab. Patty's saying, when I was the CLEAR lab director for a series of community hospital, I had an MLS coordinator over all 7, and the hospital staff, you mean in the hospital labs were staffed by nurses, paramedics, and radiology techs. I'm sorry, all moderate complexity testing, but over 250 professionals rotated through all 7 labs. Was a competency nightmare. Each had their own CLEAR number. So I'm glad, we're bringing awareness to this and having this conversation. So many times I'm sorry, we go along with our, and Patty was the president of CMLA, right?
CLMA. Oh,
so
yes.
Patty's been, she's been very active in professional organization for many years. And Dr. Salas was saying, I've had one client that was a rural critical access hospital. They were having many issues, one of which was with their blood bank. It is ultimately the lab director who is responsible for hiring competent people per CLEAR. But the problem is that it's hard to get the lab directors involved in participating in the hiring. Also, it becomes harder if a lab transitions from a moderate to a high complexity, as was the case for this rural lab. If the lab director and leadership at the rural lab, and I think this is continued somewhere, I think, or I don't see it, but maybe she's continued to type. So you have a lot of engagement here, and hopefully the conversation is gonna be, we can continue even offline this conversation. But I'm sure you have some ideas of some possible solutions that maybe you could share with some managers. So could you share any possible solutions to some of these challenges that are in rural labs?
Sure. I have some more of the what I like to call the big picture solutions because of the research I've done. But I definitely rely on a lot of, and I'm hoping to get more of these solutions from these managers who are in the trenches. So I'm very appreciative of all of this engagement. I'm definitely reaching out. So watch out. I'll be contacting you. Because some of the policy or higher level solutions that I've been looking at in terms of because of the area of expertise that I'm approaching it from is funding. And the other angle that I have as part of the solutions is education. And so talking from the policy side, the funding side, I've been very active and engaged and looking at funding that is hopefully potentially coming in through support from the government to help pay for the training of this laboratory staff, the laboratory personnel. And so, for example, a number of the organizations, laboratory professional society organizations, are currently engaging in the Allied Health Personnel Act, which is going to be hopefully supporting with funds and grants to pay for individuals to train in not just laboratory science, but other very needed allied health professions. And so that effort is ongoing. And if you haven't done so, I'll be happy to provide information on how to reach out and contact your representatives at this that are going over to Washington, because these are things that have been solutions for physicians and for nursing, and they have the good things and the setbacks. So as we know, for physicians, a lot of them will train in a rural hospital so they can get their medical school paid for or supported. Then they have to give back to the community, those types of grants. But there's nothing like that for allied health professionals. And I do believe that that would be incentive for a lot of people if they could get that funding. Other funding sources would also be to pay the hospitals to be training sites for these individuals, because if you're getting paid by a grant to train people, then you can pay some of the time of your laboratory professionals to train them. So this hospital-based program obviously exists, and that's a model that's available. So maybe growing some of that in those rural areas and funding those programs at that level somehow, so that they can also train in-house and take some of these people who are maybe lab assistants or from other professions that are interested in transitioning into that MLS role, to be able to pay for that and train them and get them to that level. So that policy solution, of course, takes time and a lot of energy. But I think ultimately there is a huge need and an opportunity right now. COVID has really highlighted the huge need for testing. And so we need to take this momentum. And I've heard this before, COVID has been terrible, but the visibility of the laboratory has increased, and we need to take that opportunity to tell our representatives, did you see all we did in this past year and a half? We need more people to do this. So I think that if there's any call to action that I leave today with is contact your representatives and tell them to give us money for training programs and for facilities to be able to do this, because that's important. So that's one aspect. And it does tie with education, which is the other thing that I'm very interested about. So even now we have a lot of individuals who have maybe bachelor level training in science, but want to work in a laboratory. So helping those individuals get the certifications is critical. And one of the things I used to, before working in Kansas, I worked in a program that was hybrid, where they would have some of these component online, and then we would train them on the technique in person in a very compact way. But that facilitated the opportunity for people who didn't live in the big city to come in for that very important training, and then we would place them in the rotations at their hometown or very close to that, so they wouldn't have to move. And so that, I think, was one of the most rewarding times for me. I mean, I love teaching. I've always loved teaching, but knowing that those communities were gaining certified laboratory professionals through that work is one of the things that I know that's a great opportunity for those individuals to have that happen for them. And so I think that that's not the only way, but with more online connectivity, with a little better reach of Wi-Fi and other technologies, maybe we can have those hybrid models and online training for people who are already interested in maybe working as processors or phlebotomy or other laboratory related things, to gain that certification and that training to be an MLS certified individual or MLT. And we really need to kind of start putting our minds together. What of all of these other methodologies can facilitate this training for people who already want to work in a laboratory, already are showing their interest, but because of multiple things like distance, geography, or not being able to pay or something, they're not able to do it. And so to me, those are like more of a macro solutions. Obviously, that's what I can read. But I know that the more point solutions, that things that managers are doing, that are working, that is where the gold mine is. I feel like I see the kernels lining up, but I need to find the gold mine. I need to find where that is. And that is by speaking to people who are already doing the work.
Wow, awesome. I love a lot of those ideas. And as you say, just putting our heads together and, especially talking to people who are actually there doing the work, they have just so much ideas that we could actually run with. One person may have an idea, but working together with these ideas could just blow up. You'd never imagine. And I know that you said something, and Aaron brought that up last week, and I'm also going to look at his the idea of having the hospitals be training ground. And I love your idea about rural, just the incentive to go to rural labs, just the same way if a doctor or nurse, and leveraging this time to say, can we come up with incentive for training, or for people who are willing to work in rural labs? So these are some great ideas, beginning with really awesome ideas. Let's hear what Aaron is saying. Aaron said ACP just published the clinical lab workforce, understanding the challenges to meet current and future needs. Yes,
Yes,
it's pretty comprehensive. And yeah, I'm looking forward to seeing your data, and feel it will lead to more insight on how to recruit more qualified MLS or for rural labs. So what's your I suppose you're aware of this, right?
Yes, and I'm very excited. I saw that a lot of the work stemmed from that previous survey that they did, where they actually identified that most of the respondents who were coming from or reporting that were from rural areas were at the MLS, MLT, phlebotomy, and oh my God, cyto or histotechnologist. It's not, as you know, we have a long list of laboratory professions, but there were just a very few people who were from those areas that were rural. And so they did a focus group study with those professions to kind of try to see what their insights were. And so that report really reflects some of that. But one of the things that I found interesting, and this is why I'm very excited to do the work I'm doing, is because even when you take rurality into into the context of where is this rural state at, because it's different to be a rural community in Maine than it is to be in Kansas, or than it is to be in North Dakota. Or Alaska. And so obviously, even those regional differences are going to factor in. So that report is very comprehensive. I encourage people to check it out as well. So thank you, Aaron, for bringing it up. And I'm also very excited because part of the research I want to do is, again, about health, because again, is using the resources that you have. And I'm fortunate enough that NIOSH is interested in looking at the health of healthcare workers. And so that is the support that I'm getting. They're interested in knowing how all of these work is affecting the health of our laboratory personnel. And I'm very fortunate that they know that this is an important thing to look at, because I know a lot of people are burned out. We know that from some of the research that's out. And so I want to know what that is like for the people in our region, because unfortunately previous studies haven't really captured the Midwest. It's like flyover country, not just for a lot of people who've never been around here, but also in terms of data. So I want to ask the people around me right now, what is that for you? And hopefully we can do that nationwide study and capture similarities and differences of even just that rural capacity. So I'm excited for that.
Thank you. So, I mean, I'm so happy to have you working on this. So happy to have someone like you with this interest, actually doing the work, doing the research to, get this done. Angela is saying that partnerships with colleges are very important. You were coming up with those as possible solution, and Yolanda says yes. And Yolanda is saying a bridge program for BS in biology or chemistry, and train and teach them, moving from there to MLS. And I started something similar in my lab and successfully filled many open positions. So we have some gold mine in the audience. I hope that at the end of this, we're connecting. Let's make sure, you're connecting with Letycia, or once you go back, Letycia, you can connect with some of these managers. And Dr. Stollis is saying, for those testing personnel without training on high complexity systems, like the different mass spec can be accomplished. Dallas for toxicology labs. There's a Shimzado Institute of Research Technology where people can pay to learn the different LCMS So lab need to invest in developing their personnel to fit equipment. So that those are really great ideas. Aaron, increased access is key. Technology has leveled the playing field to help with equity and limitation to resources in local area. Pat is saying, I had the privilege to be one of the interviewers for the ACP survey. It was really interesting. So you have some great resources here. Christina is saying how interesting. The sociology of location of lab is very cool. And Patty is saying, let me know how I can help. So you have Courtney's willing to participate. Please reach out to you. Have everybody here. Yeah, I think everybody that's on here, they're always engaged. And I think they're really great resources.
I'm
Angela is
excited.
saying, yeah, applicants need educational options, that is transfer credits and pursue further in education with an enhanced curriculum program, need qualified medical lab scientists, well as lab technician. So awesome. Awesome. So this was really great. And I know this is just the beginning, just touching the surface of, starting the conversation, realizing the challenges that we have that maybe we had for a while that we just kind of lived with. And even now it's probably going to get worse because now, not only now we're feeling it in all labs uh, right now, for the first time at Johns Hopkins, it is crazy when it comes to staffing. So, everybody's being affected right now. So,
Yes. I mean, we are here at KU. We are also being affected, and it's one of the situations where, as an educator, you understand that. To me, I've always said I will stop doing this job when I don't think that I'm giving somebody a purpose and some meaning to what they want to do and achieve in their goals. And I want to make sure that whoever is going to be working in the laboratory finds it a place that they thrive and they're happy with. And I know that a lot of people are just in love with their town and they would want to stay. And we need to keep this this communities together. And to me, having the ability to gather this information and be able to share it with as many people as possible, it's something that we've tried and it's been done by a few people throughout the years, but it kind of happens in spurts because we get busy. I mean, just like the audience is mentioning, you have one director and 7 labs, and when do you get the time to really sit down and like tell your story? And so to me, this would be something that I would love to be every year or every other year. We keep this going year after year. We keep bringing this information forward because that's what other professions do, and that's how they're heard. It's hard to convince a legislator to give you money if you don't have data. It's hard to talk to your hospital about what the region looks like if the region doesn't have a good source of information that you can convince them with, so that you can convince them to get increased salaries, provide that professional development funding. All of these things are so needed, and it's difficult. And I think that is a conversation that is happening. But like you said, we feel like our laboratories are microcosm, and we think maybe this happens everywhere else, but it's different. And we're wanting to make it so that everybody is as happy as they can be doing the very important work of testing for laboratory results. So in my mind, if that is the little thing that I can give back to this wonderful profession that I love, then that's where we're going to go with it. So I'm so excited to meet the audience today and anyone else who has the opportunity to see this, because this is the work that I'm going to be doing for a while.
Right.
I hope.
Thank you so much. So if they want to reach out,
Whoops. I feel like there's some connectivity difficulties. Is that just me? Uh-oh.
Oh, we're back.
Oh, hi, sorry.
I was like, just at this last moment. So if they want to reach out to you, and it seems as if you're frozen again, but if we get frozen, we are going to put it in the comments.
Mm-hmm.
So yes, so tell them the best place to reach out to you.
All right, let me go ahead and make this a little bigger so I can say.
No, we could put it in later, and
Okay, that's fine. So it would be I have my email from it's LNUNEZARGOTE@kumc.edu, which is my institutional email. We're going to be running this study through ASCP. So if you are a member of ASCP, you will receive an email from me and our study team to so please respond. Unfortunately we are keeping it only ASCP because of sampling reasons, but if we can, I'm really trying to open it up to other societies and laboratory professional societies, but for so that we can have a good sample. We're actually going to try to oversample rural areas. So especially if you work in a rural laboratory and you get that email, please respond, because we really want to capture that experience. But anyone who gets it, please answer if you can, because that is going to definitely give us a more solid sample to be able to gather that information. And of course, if anyone else wants to participate in the future, contact me. I'm creating a database so that we can continue this. My goal is to use this opportunity to get additional NIH funding to continue this study for a good while, not just this time. It's not a one-time thing. I'm committed. I'll get the money, we'll get it done and paid for so we can continue to gather this very important information. Because I just want to know that every person who receives a laboratory result is safe and knowing that that's what is going on. And I know that that is happening pretty much as far as I know. That is my hope. But to continue to work as hard as we have for as long as we have with as little resources as we have, we don't want to get to that breaking point. And so as much information as we can gather so we can share it with our leadership and get more resources for our laboratories, then that's what I think that we need to do. So I'm very excited to continue to do that. But contact me via email. When you get my email, please respond to the survey if you can. And hopefully I'll hear from you and we'll continue this conversation offline and for a while.
Thank you so much, Letycia. Thanks, our audience. Sorry we got disconnected at last minute, but share this with your colleagues. You can share it out right now. Click likes as many times as possible so that activate the algorithm so that more people can see this. Share this with as many people as possible. We want to make sure we're, for people who are not aware, to be part of this conversation. Thanks so much for all that you're doing, Letycia. Thank you for this conversation today. Thanks, audience, for being so engaged, and have a great one.
Thank you.
And just telling you thank you. Angela is saying thank you. I am not seeing the rest of the chat because we just got disconnected. But
I'm sorry. I do see a question. If you don't, I can go ahead and.
I'm not seeing some.
That's okay. I did see a question. It said, is anyone writing a grant to obtain money to develop lab professionals in the region? So there are some grants that are available if you're interested. I do know of 4 institutions that were funded through a HRSA grant, which is education grants, to develop laboratory workers in the region. So I'm happy to share that with you if you like, because those are the kinds of funding opportunities that exist. What I was talking about is developing more opportunities, which is what we need. But definitely, there are some funds that are available. There's also funding through ASCP that I know about that is available every year. So if you want to partner with an institution that's close to you, that they can help get this funding, and so that they can also help with developing more professionals. So I can provide a list. I'm happy to do that because there is some funding available. But I'm also interested in getting more money because we can never have enough. Otherwise, there's nothing that gets done. But yeah, I'm happy to share that information individually so that we can pursue those opportunities if that's something you're interested in.
Right. And you could put it in the comments because we'll have this recording. So once you go in, you could put a list of some of those grants so that others can benefit from that when they go back.
I will do that.
So thank you, audience. Thank you so much. And as I say, go ahead and share this out with as many connections as possible. Have a great evening, and look out for us another Thursday evening at 7:30 p.m. Eastern Standard Time. Have a great one.